Speaking of the left, Senate Democrats shifting rapidly to the left when it comes to health care, I think it's fair to say. Senator Bernie Sanders introducing today a Medicare for All bill, legislation, moving the U.S. towards a single-payer health care system. He had 16 other co-sponsors.
Yep.
You worked for Bernie Sanders at one point.
No relation.
No relation. I mean, look at that. Obviously, quite a few of them are running for, potentially going to run for president in 2020.
We don't know who's running for president, Jake, but we could argue some folks are. Look,
Booker,
I think it's important to note
Warren.
Kamala Harris was the first senator to step out and support Senator Sanders' Medicare for All bill, and then lots of senators followed. I think now what we're seeing is that it is politically popular. It is okay. It is no longer taboo to support Medicare for All. I remember being out on the campaign trail, being at different debates and whatnot, and other Democrats were coming up to me saying, what you guys are doing is infeasible, it's dangerous, this is never going to happen. And today, we've got a bill co-sponsored by 16 other folks starting the conversation. And so this bill isn't something that's going to be signed into law tomorrow, but this is a conversation that needs to get started, build on the enormous success of the Affordable Care Act, and I am happy it is happening.
And one of the things you see here is not only is there a shift among Democrats, and really a slight shift in terms of rank-and-file Democrats and how they feel about Medicare for All, it really is among independents. You look back 8 years ago, it's about in the mid-40s among independents supporting Medicare for All. Now it's in the mid-50s. 55% of independents support Medicare for All. It's like 64% of Democrats, and that's only shifted a little bit. So they're in some good territory, I think, among those independent voters. And of course, Bernie Sanders himself, an independent, not a Democrat.
Although there are Democrats, I should say, who do not support this. The majority of the Democratic caucus in the Senate does not support it, and a few of them would rather that Democrats weren't bringing this up, that they were kind of winning the health care argument because Republicans just were not able to pass anything.
If there was any question who the leader of the Democratic Party is on ideas, it's Bernie Sanders. And he will continue to shift the party to the left, which will cause them electoral problems down the road. And because even he cannot spell out how he would pay for a Medicare for All system. And you said it, Jake, there are Democrats in the Senate who are opposed to it. Is it going to pass? Probably not.
So I just want to note, I think we should be careful to let the Republicans tell us who's in charge of our party when they've clearly got a questionable person in charge of theirs. And secondly, this bill is going to start a conversation. This is not legislation that's meant to be signed into law tomorrow. This is a conversation we should be having as Americans, not just as Democrats or Republicans. And I'm happy the conversation started today.
A big part of the conversation, Nia Malika, and we don't have any time to continue it, but the big part of the conversation is how do you pay for it?
Because what is it, $1 trillion here, $1 trillion there? I mean, that's the big question.
I mean, over the next 10 years, our current health care program is going to cost us $40 trillion. And so we need changes in health care either way.
All right.
We're going to get something done.
Tax reform needs to pass this year.
Simone, David, and Nia Malika, thank you so much. Be sure to follow me on Facebook and Twitter at Jake Tapper. You can tweet the show at The Lead. CNN, that's it for The Lead. I'm Jake Tapper. Turning you over to Wolf Blitzer in the Situation Room.